cruelty and heartlessness of the Tories has made the development of work and pensions a symbol of fear, and the coronavirus pandemic has, in my view, further demonstrated the need for Labour to completely change this culture with universal welfare support that will be there to help people and support people, not punish them or police them. You know, as we face a crisis of social care with 1.5 million older people going without the help they need, I was proud to be elected on a manifesto which committed us to building a national care service. You know, we have so many fantastic policies which need defending and expanding, and it's up to all of us to fight for this future within the Labour Party. And events such as these are critical in that struggle. Before we begin, we have a special speaker, and I want to give a special big shout out to Dawn Butler, the MP for Brent North, who is joining us tonight. Dawn, in my view, was an outstanding companion under Jeremy Corbyn's leadership. As Shadow Secretary of State for Women and Equalities, she has led the way, really. Over the last 5 years, she has been instrumental in bringing the fight against this institutionally racist government. In recent months, she has been a tireless campaigner in calling out the personal racism of Boris Johnson and the ingrained sexist and racial discrimination which is perpetrated by this government. So Dawn's contribution to Labour's policy resulted, of course, in the brilliant Race and Faith Manifesto, which is packed full of urgently necessary policies, including the interrogating the legacies of British colonialism and slavery, which are right for this moment. That is why it is so important for Labour members to engage with the National Policy Forum to defend and expand this radical policy programme. So without further ado, I want to take us to our brilliant first speaker, Dawn Butler. Over to you, Dawn.
Great. Thank you very much, Claudia, for that very warm introduction. And it's a great pleasure to be here today to talk about some of the policies that were developed under Jeremy. And I just want to say that what I'm going to do is just focus on the policies so that it's very practical, so that people understand some of the areas that they can feed into the next manifesto. And it's really important that these policies are practical and they're workable policies. After the killing, the lynching of George Floyd, people have been saying, what do we do? Where do we go next? Now, the policies that I developed for the manifesto gives a clear guidance on where we need to go next. So I do expect policies to be picked from there, or I even expect the Tories to be picking policies from there. There was an announcement this week that what will happen is the Bernie Grant Leadership Programme, there'll be a further investment in that. That was a really powerful policy. And as we celebrate this week 33 years since the first Black and Asian MPs entered Parliament to stop it being an all-white Parliament, we understand just how important policies are. So we've got, first of all, the Emancipation Educational Trust. That is vital in regards to educating everybody all around the country in schools all year round. Now, that Emancipation Educational Trust is more relevant now than it ever has been. And it will ensure that we teach history in its completion. Everybody needs to understand history. The Emancipation Educational Trust will allow that to happen. And I think we need to push with that with some urgency, because that can not only be developed, it can be delivered, and then it can be improved as we go along. And going hand in hand with that would be the Emancipation Museum, where we're calling for a museum. There isn't a museum in the UK. There isn't a museum that talks about empire in the UK. And it's really strange, because empire is a huge part of our history. So that needs to be included in the mix. If we can develop a policy around that, I think that would be a very powerful statement, but it will show that we are moving forward. Also, the ethnic minority pay gap. As we know, the government has said that there doesn't need to be any reporting of the gender pay gap this year. Okay, because of the pandemic, that could almost be excused, but there will now be a rolling back, and we will go backwards. And as we know, the ethnic pay gap is even bigger than that. So we need to ensure that that is put on the statute books, and that is mandatory consideration for all organisations. So we need to fight for that to be part of our policies. And then we've got the EHR, the Equalities and Human Rights, I almost forgot what it's called then. We need to ensure that that then becomes more independent, and the government feeds into that and refunds it, because at the end of the day, they took money out of it, and now the money needs to be reinvested into that. This was all part of the Race and Faith manifesto. We need to ensure that some of the recommendations that we have done are now implemented, such as the LAMI review. We need to tackle the amount of African, Caribbean and Asian children that are in custody. And as we know, there is a education to prison pipeline, so we need to look at the exclusions. And it is vital, if we show that we really have got our finger on the pulse as a Labour Party, that these are the policies that we continue to pursue. We cannot take our foot off of that pedal at all, because things will just roll backwards. We need to ensure that some of the reports, and on Thursday I have a debate in Parliament how COVID has affected the BAME community. And what we have to do is we have to look at the structural and systemic racism that exists in society. And Labour needs to be at the fore of that. And we need to know what we're talking about. We need to know that everybody has that understanding when we take the battle to the Tories, and also when we take the battle on TV. I'll talk about a couple of other things. We need to implement the lessons learned from the Windrush review. That hasn't been done. The Labour Party needs to say that should never happen again, and the compensation needs to be paid. But not only that, the systematic racism that resulted in that, the hostile environment, we need to make sure that that doesn't happen again. So hopefully that will give a flavour of some of the things with the National Policy Forum that needs to be fed into that to make sure it becomes part of Labour's policy. If we lose any of these policies, I think we begin to lose the heart and the soul of the Labour Party. I think we will begin to lose what it was that brought us to this place. We'll begin to lose why the Labour Party exists. So it is absolutely vital that we hold on to these fundamental principles that we all believe in, and why we became members of the Labour Party and why we fight for a Labour government. We cannot have a Labour government without these fundamental policies. So thank you very much. Thank you.
Thank you so much for that, Dawn. That was brilliant. You know, the importance of the very brilliant policies that were developed during your time with Jeremy, and you know how important those policies are for holding on to our socialist values and principles. And it's right for you to call those out, because we've developed some fantastic policies therefore. And in a sense, you know, those policies are so right for this moment, given the horrendous lynching of George Floyd in America and what it reminds us of in terms of the UK and the fact that we are not immune from state-sanctioned racism in this way. So I'm just looking, Dawn, before, I know that you have to leave us, but before Dawn leaves us, it's important that we are able to put one or two questions, if Dawn doesn't mind answering one or two questions. And Lily, we've got a participant called Lily who's asked about the levels of state pensions compared with other European countries. I'm not sure if that's quite one for Dawn, but I don't know, Dawn, if you have anything to say about state pensions. I know that there's been a lot of support that you've given to, for example, the WASPI women and so on. So I don't know if you want to come back if you're and just add something there.
Do you want to take three, Claudia?
I would want to take three. They're just not. I don't think they're just coming in fast enough.
All right. Okay.
Yeah.
I mean, we do have to look at, state pensions and what happened to the WASPI women. It's an absolute disappointment that we didn't win, because we would have corrected the injustice that happened in regards to the state pension. But there's so much stuff that has to happen post. So as we come out of this post-COVID period, what's going to happen is the government's going to say, right, we're going to be in a very deep recession, and then we're going to see they're going to try and implement policies that will be worse than what happened over the last 10 years. So what happened with the WASPI women, would be magnified, even tenfold. So what we have to do is ensure that we are fully prepared to say, no, we cannot have the political choice of the political regression of people's rights and services and standards of living. And so we have to be extremely aware and acute to what's ahead of us, because the government's going to use this as an excuse. And also, don't forget, they're also going to use Brexit as an excuse as well. So all of these things built together means that those people who are currently struggling will struggle. Those people that haven't got inherited wealth will struggle. And so we have to be acutely aware of that as the Labour Party, to be ready to stand up in opposition and say, no, we will not allow that to happen. Because what COVID has done is COVID has highlighted that it's not the great leveler of a virus, because if you are poor, you have a higher risk of dying. If you are old, you have a higher risk of dying. And if you are black, you have a higher risk of dying. And if you're Bangladeshi, you have a higher risk of dying from COVID. And that's not because of anything internal in terms of genetics. It's because of the government's austerity policies, which we need to stand up against.
That's brilliant. Thanks, Dawn. Just got a question in relation to older people. And often older people feel they are being discriminated against. And I think that obviously is impacted more during this lockdown and coronavirus. So what if you just say something about your thoughts on older people? And then just another question, just really asking whether or not we believe the shadow cabinet, Labour shadow cabinet, are on board with the policies that you so eloquently outlined.
So yes, the interesting thing was that for some reason I found it really hard to understand why this government was attacking older people in the way that they were, because the demographics of people that vote Conservatives, there's a higher demographics of older people that vote Conservative. So I couldn't understand the attack on older people. But more importantly and deeper than that for me, I couldn't understand the disrespect that's there for older people. And we really do need to tackle that area and that element of society, because there are people who have, and it's the same with the Windrush generation, but there's older people from all walks of life who have given so much to the country only to get into their sort of twilight years to be disrespected in a way, and to feel less than, when really we should ensure that once you become older, that you are elevated and respected and celebrated. And so it's that kind of thing that we need to build back into society, which I think has been lost. And there's no way, for instance, that things like the Freedom Pass, to remove the Freedom Pass is literally to remove the mobility of lots of people that need to get from A to B just to improve their standard of well-being and their mental health. And you think to yourself, what kind of society do we live in when that is how we treat older people? Remember, we will all get old at some point. So it is in our best interest to make sure that everything's in place, that older people are respected. In regards to the shadow cabinet, I think it feels like they are still finding their feet, which often happens. I mean, I am pleased that the Bernie Grant Leadership Programme was acknowledged. But and sometimes, you do have to give time for new people to come in and find their feet. It was a concern that, as soon as people were saying, what should we do, that we didn't just hold up the Race and Faith Manifesto and say, well, actually, all the policies that we need to deliver to make the country fairer and to make society fairer and to be more contained, in this manifesto. And I feel that that's why this consultation is so important, because it's fine to build on policies and it's fine to have new policies, but what we cannot do is to throw away the policies that we've worked so hard on over the last 5 years, because they are bloody good policies.
They are indeed very good policies, and Dawn, you've been a brilliant advocate of those policies, really, and we really thank you for everything that you have done really for the party and really pushing forward this agenda, because we know it's not difficult when you're pushing on issues of equalities, especially when you've got a government, as we do, that doesn't even recognize, if you like, the racism of itself, and the fact that we now, officially have a racist prime minister. And yes, I'm going to call it, because Dawn called it first, right? So, thank you so much, Dawn, for everything that you've done for the party, and for really spending some time with us this evening and sharing those inspirational words. So it's brilliant. Thank you so much. I know you have to rush off to another Zoom call, but thank you so much. Okay.
Thank you, everyone.
Okay, bye-bye. So we're going to, without further ado, I just want to remind people, if you've got questions, then please keep them coming. If we don't answer them fully online, then we will ensure that your questions are answered, and they'll be posted on the Cosmos website, and we'll get those questions coming. But what's really important is that you use this opportunity to really respond to the National Policy Forum. And in that respect, I want to take us to our next speaker. And our next speaker is the brilliant Anne Henderson. And of course, Anne was our the membership's elected NEC National Executive Committee representative, representing members. So without further ado, I want to hand over to Anne Henderson, not only the NEC representative for members, but also chair of the Equality Subcommittee on the National Executive Committee. So over to you, Anne.
Right, so thank you very much. Thank you for this chance to join you and to discuss some of the mysteries of the National Policy Forum. I think just to build on Dawn's contribution, inspiring as always, I think for me, one of the frustrating things at the moment is that question of what are we doing to, we've already got policies that are kind of ripe and ready to use. So when we're looking at the National Policy Forum process, it very much has to be how we build on what was there before. So specifically, I think one of the problems with the way it's framed is this is the beginning of a 5-year consultation. It's about thinking about the manifesto in 2024. And whilst that's true, I think for me, the importance of what we say now is what's resonating with people. So the concerns that have been expressed about some of Jonathan Reynolds' comments recently about maybe conditionality appearing, the policy, the discussion and conversation around housing and around rents and landlords, where some of the statements were not sitting comfortably with the membership, with a lot of our membership. I think so it's not about just waiting till 2024. I guess that's what I really wanted to sort of frame this in. So, because we have got to say, as a shadow team, there will be things being said every day of the week, particularly with the focus on the COVID crisis and what comes next. So we have to get, our framework has to be clear now. 2024 is a very long time away. So also in terms of what we will have in front of us given the crisis that we're now dealing with. So I think, and we've got elections probably, if they go ahead in 2021 in Scotland, Wales, the mayoral elections and the local government elections. So any conversations, for instance, I'm going to look a little bit around social security because that is the topic that the actual physical consultation paper is on at the minute. Conversations that question universality or question whether you've paid in enough to justify getting money back, or questions of who is deserving and undeserving, are having to be dealt with on a daily basis by local authorities, by regions, and by governments. So we have to keep our heartfelt principles and our beliefs in what we're trying to achieve with a social security system and a support system for every citizen. It has to be a non-discriminatory system, and we have to keep using the language to defend those things. Millions and millions of people will need the state system over the next few years, and millions of those people will not be able to pay in because of the circumstances in which they find themselves. So we can't start judging who deserves and who doesn't. And I think one of the opportunities in a terrible sort of way is that there have been thousands, there's probably millions, certainly thousands of people who had never expected themselves to have to call upon the state system, have found in recent weeks that that's what's there, and they're glad it's there for them. But they've also realised very sharply that the level that universal credit pays is not very much, that there are all sort of gaps in the system. The gaps in the system, some of the things we know about, like the waiting time, the waiting period, the various, for universal credit, the various challenges. So those things were all in our manifesto, that we were going to change that. We would not just scrap universal credit, but any system we introduced would pay from the point of registering for it. There wouldn't be these means tests, So I think there's an opportunity for a discussion about, like, right now, is the system meeting the needs of the people? And it clearly isn't. And so I think that's important. So, but I think talking about post-COVID is actually it's quite difficult, really, in some ways, because I think it's going to be a long time. Sometimes the conversation feels as if, oh, by the end of the summer we'll be able to pick up where we left off, and it just obviously certainly I think it's becoming more clear it's not going to be like that. So again, it's really important what we say now, because what we find by 2024 will be shaped by now. So in terms of how that relates to the policy forum, the National Policy Forum, yes, so it's the first stage of looking at the manifesto for 2024, but the framing, as it's not a blank sheet of paper, in my view, we've got something we're building on. So it looks to me, from the submissions that are coming in already to the National Policy Forum, on which I sit, which is work, pensions and equalities, lots of people coming in with different topics, all sorts of different things, and many of them reinforcing things that we would have said in 2019, stuff around basic income, stuff around pensions, as people have flagged up. But so you can submit on anything in answer to sort of a process question. People can submit on anything within the remit of work, pensions and equalities, and obviously the equalities remit is massive. All three of those headings are massive, but you can submit your thoughts on any of those questions. specifically, there's a short paper, it's quite difficult to find, but it's on the website, that page of the website. There's a short 4-page paper on social security. And that closing date for that is the 30th of June. So it's quite urgent that comments go in on that paper. So in a sense, we've got longer to make comments on other aspects of the remit of that policy commission, but the focused paper on social security has to be responded to now by the 30th of June. And I think it's an opportunity. I mean, there's reiterate some of the points that were in our manifesto, but there's also, and there's some good points in there about how a different social security system has to take account of inequalities, has to tackle the discrimination women and Black and ethnic minority citizens face, and so on. But for me, it's quite weak on, it's very open-ended. So we really need to make some suggestions. It's not enough to say, in 5 years' time, when we're in government, our system will do X, Y, and Z to address these inequalities. I think we need to be thinking now of policies and demands which we feed into that process, but which we speak about now. So even small things like the argument, the position we always had about the credit should be possible to split payments, and also possible to arrange for housing benefit to be paid direct to the landlord, and things like that, which would be beneficial to people. Splitting payments, the child element of the payments, so that the primary carer, who's often a woman, has some source of income. These are really, really important things, and they need to be argued for like now. So I kind of feel there's it's a process where there is a long-term goal, and there's the looking to 2019 and holding on to that, but there's also what we frame and say now in the public domain, and we can shape, I think, some of that through campaigning on policies that go into the policy forum process, but also remind the current shadow cabinet members that, you know, there are things we need to be saying and doing now at the dispatch box, and we're watching what people are saying and doing now. We're going to keep an eye on that. We're going to discuss with them. We're going to let you know, it's a process. It's particularly as it's a crisis that we've never, of the scale that none of us really have any, you know, anticipated tragically, nor have any experience of dealing with. So so those are some of my kind of thoughts about the National Policy Forum. I wanted to just quickly say a little bit about Scotland, and the reason for that really is just to use it a little bit as an example. So we have devolved powers to a lot of, some of the social security powers are now devolved to Scotland. So, and I guess the question then is, how do we make sure that party members and activists and labour movement people in Scotland work together work together with everybody in the UK to shape a social security system where the bits all join together. So there is a perception possibly that some of the powers that we now have in Scotland are being used by the SNP-led government to make positive change. So on one or two small things, like we have split payments arrangements here, so that's a good thing. On bigger questions, interestingly, where universality has been offered and campaigned for, so we had a big campaign last year about topping up child benefit by £5, simple campaign, universally delivered, £5 top up for child benefit. And the SNPs and the Tories voted against that, consistently voted against it, and have instead introduced an application-based payment of £10 a week, but for certain children and targeted at low-income families. So it's not a universal benefit, and it's application-based. And by making an application-based process rather than delivered, and that's, I mean, it sounds a bit processy, but it has the effect of reducing the uptake. It has the effect of meaning far less of the families who are entitled to something will get it. So there's something about, and you can apply that to a whole number of benefits. So how do we devise a social security system which actually reaches everybody who it's entitled to receive it? And how do we make sure that they don't have to search it out, especially as many of the people who at the time at which you most need a hand are not going to be spending hours on the internet looking to see what they're entitled to, or, you know, they need to be able to just to get it really quickly, really simply, and by well-supported staff, which is the other issue, and that's been the staffing levels and the cuts in the workforce, which in the DWP and in Social Security Scotland and the other the other services that deliver. So again, that's a good point. It's in the consultation paper. It talks about the workforce and the staff, and not doing everything online. But the staff has been absolutely overwhelmed, as we've seen by the universal credit statistics and the demand for services. So we've got to have something in there about the workforce as well that deliver the system that we envisage, and we need to be bold about it. We need to use the information we've got just now, like about everyone is talking about key workers, and we know the kind of the critical role that care workers and health workers play. We know they're underpaid. We know these things, but are they adequately covered by other things in our system? Like when we think about the industrial injuries benefit, we think about jobs. Are we thinking about the jobs that actually are placing demands on women and men's health at the moment? So I think we need to think a bit outside the box as well. But the responses are quite urgent, I would say, procedurally. It's really important that we get things into the paper that's currently out there on Social Security. That's all for just now. Thanks very much.
That is absolutely brilliant. And I mean, the ability to be able to outline in very clear terms the impact of our policies and how they play out in terms of social security, in terms of work, and really the crisis that we face, and the fact that are we prepared really for an impending recession, and who will this fall hardest on? You will appreciate, Anne, we've got a range of challenging questions, I think, from arising from your presentation. One of the first of which is really to do with structure and the concern around the National Policy Forum, because you touched on some of the way in which the National Policy Forum operates. But one of the challenging questions is, should policy, and this is hopefully a rhetorical question, but should policy be determined at the party conference, or should it be determined from the leadership or the PLP, or indeed the National Executive Committee? So I wonder if you can just reassure people about that question, certainly. Then just some wider issues around the structure of the NEC and National Policy Forum. There's a question from Kingsley about the structure of what has happened to the new black structures that were announced in the 2018 national conference, in fact, and whether or not you've got any update as far as you understand it from the National Executive Committee. And then there is a question about your thoughts really about the racism in the Leach report, and whether if you've got any thoughts about that you want to share, then please do. If not, don't worry. We don't want to hold you to that unnecessarily. But then coming to the questions around policy itself in relation to works, pension and equality. There is a question about whether your view on child maintenance and the unreasonableness of asking single parents to collect payments from absent parents, really, and your thoughts about that for the moment. And then there's a broader question about there's a feeling about the politicization of the civil service, and whether or not that's already been partly privatized, and the impact of that, really. And then just one final question. This question is dear to my heart, certainly, and that is the issue of no recourse to public funds, and your thoughts about policy around that, and certainly From my perspective, that is one of the biggest challenges that I face in my constituency, that we have people obviously who are here on a status of no recourse to public funds. Some may be allowed to work, but of course in the context of a pandemic and lockdown, when that work disappears, there's literally no recourse to public funds, and this is a government that won't even relinquish that piece of policy in this pandemic. So your thoughts on all of those questions, and if that's not too much trouble. Thanks, Anne.
Okay, so thank you. That's quite a few. So in terms of the policy making process, yeah, no, I mean, I think annual conference is sovereign. I think that we have to make sure that as we've been, people over the years have been working on trying to do this, like CLPD and other bits of the party, to make sure that there are motions and that, you know, there's a route through which constituency Labour parties and trade unions can actually get things onto the agenda of the annual conference, because in the not too far distant past, when it was a gathering solely around policy consultation in a very unstructured way, it's very difficult to find out it's very difficult to actually have a discussion about how to arrive at a settled position. So I think that's important. I do think we've got some challenges now, because in the situation that we're now working in the annual conference, not just annual conference, Scottish Party conference has just been cancelled as well. The Women's Conference has been cancelled. You know, there are some real difficulties that we need to think about how do we actually, which is in a bizarre way really, because the National Policy Forum is by no means a suitable or perfect process, and we had agreed to review it and replace it following the democracy review, but actually at the moment it's the only route we've got to collectively make some voice about what we think. So if of submissions to the policy review, for example, defend universality and put forward other positive proposals, that becomes the party, at least becomes a voice of party members. Clearly it's not binding anybody to anything, but it certainly makes it easier. The NEC discussed, well, generally speaking, the NEC is not a policy making body. And in fact, I know that members spend a lot of time when CLPs are meeting, sending motions into the NEC. And at the moment, as Seema and others have highlighted, nothing really happens to the motions. I have to be honest and say that they're noted rather than take it, or they're referred to the policy forum, so policy commissions. So yes, I mean the sentiment is right, but collectively we need to do a little bit of thinking of how we're going to work to demonstrate and debate in a situation where it's not possible to meet together other than by these types of means. So that's on in terms of the equality structures that were agreed by democracy review. I have actually, when I can work out how to do it, I'll share the paper, because I've written a couple of pages just summing up where we're at with the rule changes, and the rule book for the Labour Party. It's obviously not massively exciting reading, but it does now contain, it's online, it does contain the chapters that describe how women's, what I would have called women's forums, but women's branches, women's sections can be set up, and the same for Black and ethnic minority structures. So it's detailed in the rule book, and the guidance is there where you should get support from your constituency Labour Party in setting those bodies up, and they now have a clear, in the rule book now, a protected role to both make suggestions and proposals around delegates to events, but also to propose policy motions into the CLP and up to other bodies. So the Women's Conference, had it gone ahead this year, would have been built on those structures. And I know it's controversial, but I mean, the outcome may have been controversial, but there was, the elections have been conducted for the Black members' seat on the NEC, and we'll be working out how to do the elections for the disabled members' seat on the NEC. Not perfect, but there is change there, and I really would encourage people to use the new structures. Again, given the constraints we have on meetings, but I'd be pressing to locally to get Black members together and to use those, organising the framework that is now set out in the rule book. But I'll share that paper on the chat. With terms of the leaked report, appalled, generally horrified and appalled by the much of the content of it. the NEC have been advised that some action has been taken, but clearly the detail is confidential. That's all I can say, and I mean that's all I know. We've asked for a public statement to be made to that effect, so that the members, because I'm continually being lobbied correctly by members across the country for action on racism within the party, particularly in the context of recent events. So yeah, all I could say is that on the NEC, a number of us are consistently asking for action and pressing for that. The next NEC meeting is on June the 30th. In terms of the independent inquiry which has been set up, there is I don't have it to hand, but there is a dedicated email address for that, and anybody who wants to submit comments or anything into the independent inquiry can do so. On child benefit, I think just like child benefit should be it's not a cost-effective way of dealing with the situation arising from separated parents. It's not appropriate, and it's cumbersome, and it's expensive, and it doesn't benefit the woman or the child, basically. So I don't think personally, I don't think there's any, I wouldn't have it in a new system. Just would have straightforward child benefit, non-means tested support, which should be paid to the main carer. Civil service, yeah, I'm not sure. Do you mean this? I think the civil service shouldn't be a private. None of these things, and it's the same with social service, with the social security, and the delivery of these state services should be delivered by the state. They shouldn't be privatized. I mean, that's kind of where I think there's scope as we go forward. There has to be scope for arguing, like right now, for a massive expansion of the workforce, actually, to deliver the services that we need. And we know that with the recession that's coming and the scale and complexity of it, that the pressure on the state and on the workers who deliver that service, and the need for things that are not necessarily, people are going to need some form of face-to-face meetings, they're going to need help to make sure they get their entitlement, they need a well-trained and supported staff to deliver that. So I think we're talking about a bit of recruitment for staff, both now and in the future, and the service that we would build would be delivered in that way. But right now it means also arguing for support for PCS and the members of the unions that are trying to deliver a service in very difficult times. On the last point around no recourse to public funds, totally agree with you. I mean, I think I was reading the report from IMCAN, and I think that the points they make are really well founded, both around actually ring fencing specific funding allocations for projects that work with Black and ethnic minority women, with Black women, even and absolutely for just ending the no recourse to public funds condition. I think that the fact that there's been, like I know in Edinburgh, for example, because of the way the housing policy, the homelessness policy is being applied, everybody is being housed at the moment, including those who have no recourse to public funds, given they are covered in the same way, which is a consequence of, you know, the relaxation as a result of COVID. But we absolutely have to argue for that to continue. There's no need to have, there should be no such thing as no recourse to public funds. And so I think that has to be right, you know, at the heart of one of our policies.
Thank you so much, Anne, and that was a brilliant run through there of the very important and very challenging questions that you've had put to you there from members. And thank you for your honesty as well in terms of sharing as much as you could at that moment in time. So that is brilliant. And I know that people are asking for the link in terms of the paper that you've outlined in terms of the Social Security paper. And I just want to reassure people that we'll put that and make that available certainly on the Cosmos website. So that link will be made available and will be shared in the chat as well, so that people can pick that up. But it's really important, and I think as Anne is highlighting there, really, that you should, you know, you should know that you've got a friend on the NEC that is fighting and making sure that our policies remain front and centre. And I think our task, therefore, is to respond to the National Policy Forum and ensure that the policies that we have been putting forward over these past 5 years, and indeed expanded on, ensure that we respond to the National Policy Forum so that we can indeed expand on those. So without further ado, I want to move on to our next speaker, and our next speaker reflects really the Disability Labour Forum, and our next speaker between the co-chairs of the Disability Labour Forum. I want to introduce to you both Fran Springfield and Kathy Bole, who are on the National Policy Forum but are co-chairs of Disability Labour. So over to both of you, Fran and Kathy.
Claudia, thank you so much, and thank you for inviting us to be able to talk this evening. I just want to pick up on that whole issue of no recourse to public funds. I live in Lambeth. I've been part of one of the groups supporting people through a mutual aid COVID group, and what some of the saddest stories that I have had to deal with in the last few weeks are women who've been in that situation. They are women who are facing destitution, they're women facing poverty, they are women very often also with disabilities, very often with post-traumatic stress disorder because of what they've been through in their own country. We were looking after 2 women in particular who, having got here with partners, those partners actually were then violently abusing them. So we were in the situation having to sort out all of that and somehow finding safe accommodation for them, which was incredibly difficult in the current climate. So I'm really feel that the issue of no recourse to public funds must not exist. We cannot have this any longer. It is just, you know, it's a stain on our society, and it should not be happening. But back to talking about the things that I was actually asked to talk about. And I just want to start by making it clear that we had a meeting with Jonathan Reynolds yesterday, and he wanted to make it clear to us, and therefore I want to make it clear on this call. What he said was we should always support those who want to work while ensuring those who can't are able to live in dignity and comfort. There will always be part of a social security system for those people who need it, whether they have paid in or not. I'm going to talk about 3 particular issues. One of them is the WASPy women, partly because I'm a WASPy woman and this is something that's affected me. It's the policy that came out during the general election was just amazing. I listened to that and I thought, oh my gosh, if only, if only, if only. And of course, sadly, it didn't happen. And WASPy women mustn't be forgotten. They must not be left behind. We have had such injuries to our homes, to our working life, to all sorts of problems that have occurred because we've had to work these extra 6 years. For me, it's meant an extra 6 years on perilous benefits and being constantly reassessed by the DWP. And none of that should have been happening. Whatever we do, even if we only find a scheme which was 50% as good as the one that we put together, we've got to do something. The next piece of thing I want to talk about is social care. We all know that social care is in crisis. There was far too much of a push to reduce care hours and move young disabled people into care. Just at the beginning of the pandemic, I got a phone call via the COVID group from a young disabled lady living around the corner from me. She's 31. She has complex medical conditions, and there had been a difficulty with sorting out some of her care hours, and the social worker's view was that, oh, we'll put her in a nursing home during the COVID crisis. She was terrified, as was I. And despite the fact I was starting lockdown, I actually went round to advocate for her and to ensure that she was not carted out through her front door without her consent, because that was almost what they were threatening to do. I'd never been in that situation with a local authority trying to do that to somebody who was so young. It was utterly horrendous. But it shows the way that disabled people are treated, which is why everything about the care system as it is now has to change. We cannot continue as we are. the whole issue of people being transferred straight from hospital into care homes where they knew perfectly well that those residents had COVID. There was no question about that. They dumped them into care homes because it was a clear and easy way of making sure that there were more beds in the NHS. And yet they failed to provide all the PPE for staff. My daughter is a manager in a care home. She lost 1/3 of her residents in 2 weeks. My daughter is also adopted, she is black. And my fear as a mum of a black child was, oh my God, what would happen if she gets this? I've spent the last few weeks terrified, absolutely terrified that she too might catch this. Because the whole issue of why people of ethnic backgrounds are getting COVID worse than everybody else has to be looked at, has to be properly investigated, and has to have some money, if necessary, put into the health service and put into those people's lives to make sure that never ever happens again. I'm well aware that the government report did not contain the recommendations, which I have been assured were written. They were just removed before publication. And I do think that's something that we need to put a huge pressure on the government to do something about. Local authorities currently pay the lowest possible money they can afford to put somebody into a care home. That means that care homes are run on a shoestring. It means that their staff are badly paid, very often under the national minimum wage. They will very often find themselves into a situation where they can't be unionised because employers will not consider that. It will make life really difficult for any staff member who tries to join a union. And I know that from the experience of my own daughter, who's been well brought up and knows to join a union despite her boss's horrendous attitude to her because she did so. But of course, the other issue about keeping costs down means that many care home owners cut corners. They will employ people who may not have appropriate residency papers, but that of course means that they can employ them almost as slave labour, paying them, any little amount of money they want, making them work for as long as hours as they want them to work. And that has stopped. There is no other way of describing it other than slave labour. And we should not be condoning that with public money. We have to have a national care service. But for disabled people, more importantly, we have to have a national independent living service. What is that and how will it work? It will work on a national basis in the way that the National Independent Living Fund did before it was abolished. And for those of you who don't know much about National Independent Living Fund, it was a nationally controlled sum of money that was given to severely disabled people who needed help and support to live in their own home. It was totally separated out from any social services funding in local authorities, so it was purely government funded. And we were assured when the NLF finished that that money would be transferred to local authorities and would be ring-fenced for us. Well, you can guess what happened to that. Nothing at all. The money got dispersed all over the place, and disabled people have spent the rest of the time fighting to get the minimum hours of care that we need. So how do we resolve this? Well, we go back to having a national care service with national guidelines as to how much care somebody should be having, so that it can't be done purely on a local authority budget. We need to have disabled people involved at every stage of that process. Some London boroughs are really doing a good job of this already. Go to Hammersmith and Fulham and look at their system and then transform that into every local authority in the country. They have disabled people at the start. We had a whole consultation. I was living in H&F at the time. We had a consultation for disabled people asking us what we wanted and how we wanted the service to run. It has now started the commissioning process. It is run by 2 disabled people who were part of that process, and they will be managing everything from there on in, with other disabled people guiding and supporting, and making sure that everything is focused on giving us independence. Because that's what we want. We need to be able to live independent lives so that we can actually do things like campaigning and not just be stuck at home. You know, there are lots of us with lots of skills and lots of knowledge, and we want to be able to use that and use that constructively. And we can only do that when we are the guardians of our own care, which is why we have to have a national independent living service. And I'm going to leave it there and hand over to Kathy to talk about mental health.
Thanks, Fran, and thanks, Claudia, for having us. I think one of the biggest things that this pandemic has taught us is that everybody can be afraid, everybody can be frustrated, everybody can be fearful. And what is disturbing, I think, is the fact that because of the lack of investment in mental health provision all across the country, we are finding that services, even before the pandemic arrived, were starting to fail. And here, where I'm in Suffolk, we have the pleasure of having a mental health service that's gone into needs improvement 3 times because there's no other alternative about what you do with it. And what I'm seriously concerned about is the fact that what will happen to people as soon as some people start going back to work, other people will continue to be in this lockdown situation, and they won't have the support when it comes time for them to come back into mainstream life if they can. They won't have the support to do so, because I think we are on course for a tsunami of mental health issues, whether it's based on the situations around the inequality with Black people and how people are being discriminated against, and all of the hate that has surrounded that whole situation. I think what we have to remember is individuals will be dealing with mental health issues for far into the future. And we need to have a way to support each other through this. Now, we need to figure out how to get tools to people and teach people how they can support themselves and their families through the crises that we will continue to see. The amount of despair that people felt because Jeremy wasn't elected at the general election, and the idea that people were concerned about the new leadership and what that meant for the transformational policies that we had put in the manifesto, whether that will leave us behind, and that a lot of the good work and important work that had been done will be undone. And that in itself causes trepidation. The not knowing what's going to happen about the leaked report and the bashing of one side of labor against another side of labor and witch hunts and all that kind of stuff. It's all adding to this really, really dystopian view that we are starting to get through social media, through the reports we hear about protests and reprisals. One of the things that's gotten very, very clear from my neck of the woods, I'm a county counselor at Suffolk County, and we just had a couple of counselors being identified as propagating and spreading racist views with the death of George Floyd. So I think that all of these different circumstances are actually going to lead us to need to put into place a better system that's properly funded and recruitment in order to bring in people who understand mental health. And we need people to stand behind each other and try to be as supportive as they can. I think this goes to also our representatives, because as things get worse, the front line for government is going to be our MPs and our counselors, who are going to be dealing with the aftermath of cuts and unemployment and difficulties getting benefits, and people are going to start to cut back on their expenses based on whether or not they have enough money to live day to day, and the use of food banks and all the rest of it. The fact is that people will not have the money to go out and get somebody to help them work through the issues. And I think a lot of people, part of me said when the pandemic hit, well, at least people will realize what it's like to be a disabled person and having to live in their homes and not get involved in a lot of things. And we do it from our homes often. And I thought, well, a lot of disabled people will have this isolation thing in a good, will be okay with it. But the longer it goes on, the more unokay everybody is, especially when people are having to rely on places like Sainsbury's, which everybody has a really bad feeling about, who is on some kind of disability benefits, because they were shopping people to the DWP, and then you're having to give them your information, or information's being transferred to them in order to get you your shopping in. And the things about people who were not shielding, who couldn't get their shopping in, all of this stuff is eroding the mental health of every single person, except possibly the Tories. The compassion and the support we want to give to each other, we have to struggle so hard to continue doing that for each other and not biting each other's heads off. We just need to support each other. We need to be getting a system of mental health where everybody is supported to deal with those issues and feel supported.
That is so brilliant. Thank you for that, Kathy, and to Fran as well, really highlighting and amplifying the voices really and the needs around disability, but also just to give a platform, and thanks, Fran, for highlighting the what it's like to be someone on no recourse to public funds, and also just really putting on the platform and making clear the need for a national care service, and really, putting on the table the need for a national living service as well, the National Independent Living Service, and to Kathy for bringing home the issues of mental health and how that is really going to impact and has impacted throughout this pandemic. So thank you so much for presenting the real voices there of and amplifying the voices really of disabled people in that regard. I'm going to move us to our final speaker, really. And our final speaker for this evening is a NHS campaigner. It's Dr. Bob Gill. He's also a documentary producer, and he indeed produced the great NHS heist. So without further ado, I'll let him tell you more about that if he wants to do that, and then we'll provide a link as well for that brilliant production. Dr. Bob Gill, over to you, Bob.
Thank you, Claudia. What I want to do is to put into context the current crisis in terms of what's happened to the NHS over the last 4 decades, in fact. I think it's also important not to misframe what we're currently seeing playing out as incompetence. Because if you understand the history of what's happened to the NHS, a lot of it fits in with intentional intention rather than accidental. And finally, I want people to understand by the end of my talk, what is the end game? Where is the government taking us to? And how might the cover of the COVID crisis actually help them with their agenda? So if we could have the first slide, please. So hopefully what you'll see now is a timeline of what's happened to the NHS over the last 4 decades, really. And what you see there is that, you know, it didn't all start in 2010. We've had an uninterrupted trajectory of marketization, fragmentation, outsourcing, saddling with private finance initiative debt. And perhaps the biggest acceleration was in 2012 with the creation of a fully external market, that is forcing every activity of the NHS to be contracted out. And finally, in 2014, we had the 5-year forward view introduced by Simon Stevens, who was formerly of the American health insurance company United Health. The other things to point out while we've got this on is that in 2006, we saw significant changes to public health, and also around a year or two earlier around the GP and how general practice worked. So moving on from that timeline, how in what shape was the NHS? If you come back to me then, Peter. So what shape was the NHS in the run-up to the COVID crisis? Well, we'd had 10 years of austerity, relative defunding of the NHS, which led to we were 32,000 beds fewer than we were back in 2008. We had a recruitment and retention crisis with 40,000 nurse vacancies, 10,000 doctor vacancies, fewer beds. So we were in no shape to be taking on a pandemic. Not only that, in 2016, we had exercise sickness. Now, we knew a pandemic was not only a significant health challenge, but this was categorized as the #1 threat to national security. And what exercise sickness did was flagged up the deficiencies in our preparedness for a pandemic. Lack of protective equipment, lack of ventilators, and a desperate need to remedy these supply problems. But in 2006, we actually outsourced and privatized the NHS supply chain. In 2016, the government chose not to act on exercise sickness. They made a political decision not to prepare. So the political decision was prepare to fail, because pandemics occur. We know they're coming. So then we had coronavirus arriving on our shores, and although I was shocked by the lack of response of our government, I wasn't entirely surprised, because the NHS to them is not a public necessity. It's not about saving life. It's not about doing the best for the patient. It's a business for which it has to be restructured in order to maximize profit, and in order for that profit to be diverted to CEOs and to shareholders. Now, if a virus hits the country, which happens to affect the elderly and potentially the most expensive patients in a model that is designed to deliver profit, that is not incompatible. Having your most expensive and dependent patients succumb to a virus is entirely compatible with the business model of a privatized insurance-based system. So we had a narrative developed about staying home, protecting the NHS, and saving lives. But now we know that this strategy of avoiding testing, tracing, and isolating has led to us being at one point in late May having the highest death rate in the world. Now, this is a country that used to have a very robust public health system, the most developed in the Western world, with a long history of competence and excellence in dealing with infectious disease. But the Health and Social Care Act 2012 broke that apart. It dismantled public health systems and replaced it with a quango called Public Health England, where all the appointees are political appointments. And you have NHS England, which is in fact a privatization board. And that's where the control has shifted. So the Secretary of State for Health is no longer responsible for the day-to-day running of the health service. That responsibility was transferred to Simon Stevens. And what it has led to is we had cuts to public health budgets of the order of 800 million. We had 10,000 redundancies in public health in this country. So you have an extraction of the organizational memory, the very skills you need in a pandemic were no longer there. So the situation was set up to inevitably lead to a very high death toll. Now, a government with a conscience who genuinely believed the strategy they were following of privatization would lead to better health outcomes, well, this should be a wake-up call for them that their policies have been wrong. And it was an opportunity to restore and reinforce the NHS and public systems. But what in fact happened, if we have the next slide up, Peter, what in fact happened is while we were all just being told to stay at home and wash our hands regularly, the government was very busy outsourcing as much of the pandemic handling activity as possible. So the slide we have on screen now is from the Financial Times, and we've seen 1.7 billion total contract value being awarded to private companies without any open competitive tendering process. So these backroom deals have been struck at enormous value, and we are still waiting for them to be functional. Whereas what the government could have done was to strengthen local public health infrastructure, was to use the now spare capacity within NHS hospitals and university labs to have a very robust testing system. And it could also use the huge capacity within general practice that was now freed up because we were no longer seeing routine care. You had GPs, and my colleagues and myself, I've never had so much time on my hands. Yet this expert resource was deliberately past, if you remove the slide for me. So you have this perverse situation where contracts are being given away hand over fist to the private sector. Meanwhile, spare capacity within the public sector, which we have already paid for, wasn't used. And where did some of the money go? Well, if you look at the connections to where some of the contracts went, well, some of the IT contracts went to people connected with the Vote Leave campaign and with personal and professional connections to Dominic Cummings. A company called Faculty AI is one that springs to mind. Another company that has now got access to the pandemic data is Palantir, run by an American billionaire, Peter Thiel, who has close associations with the CIA and the Donald Trump campaign. One of the co-founders of Faculty is a person called Mark Warner, brother of somebody who's been brought in by government as an advisor. So, you know, alarm bells about due process, conflicts of interest, appropriateness of awarding contracts. In the height of a pandemic, they chose to reinforce and double down all the methods that have led us into this precarious situation. If we bring up slide number 4, this is from The Guardian, which shows, you know, if you have an infectious disease pandemic, who do you put in charge? An accountancy firm. How does that make any sense, to award this responsibility to an accountancy firm, to involve private pharmaceutical companies who have got no experience in testing, to set up a series of standalone labs staffed by people without adequate training and without due regulatory oversight? That's what the government has created, rather than using existing capacity. So if we remove that again, is any of this an accident? Well, if you just consider what's happened to general practice in the last decade, you've had the outsourcing of out-of-hours care, you've had the introduction of 111, you've had more recently the introduction of a new GP contract, which will in due course, and if you put the last slide on, I'll show you what I mean. The new GP contract will introduce perverse incentives for the GP to boost their income by denying patients care. The slide on the left is from United Health, which talks about a shared savings program right at the bottom on the left. The slide on the right is from the NHS long-term plan document, which refers to a shared savings scheme. So these are perverse incentives for GPs to deny you care. Now that's if you're lucky enough to see a GP face-to-face. Face-to-face contact with a patient is considered as a legacy system to be minimized. And the reason for that is because you can make a lot more money by digitalizing services and removing the people with the experience and perhaps the training to, and the ethical obligation to act as advocates for their patients. So that brings us up to the current situation and the threats for people to look out for in terms of the policy forum is the traps that are being set. We are being trapped into accepting that the integration of means-tested social services budgets with health budgets is a good idea. No, it isn't, because that's a backdoor way of bringing in means testing. We are also being softened up for personal health budgets. They are a device to entice very expensive patients away from requiring insurance until such time as there's been a significant middle-class shift into top-up insurance, at which point they will be unceremoniously dumped and left without care. So personal health budgets is another trap that is just on the horizon. And finally, the longer term consequence of COVID is the massively expanding waiting list, which we will be softened up into accepting this is yet another reason for using private sector capacity, and the middle class will be persuaded to look after themselves and take out private insurance. All of this overseen by the former president for global expansion of United Health. Thank you.
Thank you so much, Bob. That is, you so amplified where we are at and what we can what we're getting from this government, and really what they're seeking to introduce that is going to further devastate our communities. And thank you for really highlighting the sheer privatization agenda that is going on before our eyes, really, and how in a sense we know that will further exacerbate the problems and difficulties already being experienced, and why therefore it is so important that we have a robust response in terms of policy, and why we need to respond to the National Policy Forum. Bob, thank you for that. And I know that there's going to be so many people that are going to want to watch and see your film that you produce. And I don't know if you just want to say just a little bit about that and where people can catch that if they want to. Bob, just you want to come back in on your film?
Sure, yeah. So it's there on YouTube. It's free to watch. I encourage everybody to watch it. A lot of research and hard work's gone into it, and we tie up all these loose ends. You cannot be left in any doubt as where the ultimate destination will be, unless enough of us become informed and active and start resisting.
And I just got a couple of questions. I know we are running slightly behind time, but we do want to finish and give our audience, our participants that have really been with us throughout this, the opportunity to have a couple of questions answered. So I don't know if you want to just have a look at these two questions, Bob, Fran, or Kathy. But one question relates to the Trump trade deal. Will the Trump trade deal lead to more privatization and possibly insurance-based delivery? How will we cope? And that is a cue there to those of us who are already suffering. Is it inevitable that we are going to see the death of the National Health Service? And then another question about what changes should we call for in mental health support for young people? The current system is so disorganized and inefficient. So I don't know, Bob, if you want to start, and then maybe I'll call on Kathy and Fran to pull up the rest of the questions.
I think the US-UK trade deal needs to be at the forefront of everybody's mind. We have a NHS which is significantly privatized. In order for it to be exempt from a trade deal, it has to be 100% publicly run and publicly funded. It's nowhere near that at the moment. So it is in fact public budgets, be it social care, be it healthcare, be it education, which is the main target for US corporations. So they are absolutely under threat. And once they are tied into a trade deal, it becomes very expensive, almost impossibly expensive to get out of. So we have to prevent it ever becoming part of a trade deal in the first place.
Thank you so much. And can I just move over to Fran and Kathy, if you want to just come in on any of those?
Well, as far as I think I had something to say about the Trump trade deals. I remember sitting with you, Claudia, at a panel at a labor austerity gathering.
Yeah.
And one of the things I did before I came down there was because I have parents in the US, I was able to use their zip code to be able to check out what the costs of my medications would be if I were to go back to the States without health care provision, which would be what I'd have, because I wouldn't have work to get any kind of health benefits. And I'm not on as many drugs as a lot of my fellow disabled people are. But I'll tell you what, the amount would cost me for the drugs that I currently take, if I could get them, would be almost £5,000 a month. And that's without having any kind of help to pay that. You either pay it or you don't get it. And it doesn't matter who you are, which is the real crime of trying to sell out the NHS for big business, which is what pharmaceuticals are. The other thing is about the mental health. We really need to have a program of mental health that goes from primary schools all the way up through elderly care. There has to be a concerted effort to get funding in order to expand the services that are there, because children are ending up getting into the special educational needs circular roundabout. So, you know, it's where if we don't fight this and we don't get out on the streets and protest against what they're currently trying to do, we're going to drop out without a deal, which is obvious what they're going for, and we're going to be a waiting carcass for the hawks from the American pharmaceuticals and insurance companies to come in here and pick off little bits until there's nothing left. And the ones who will pay for it will be the people who are least able to afford to do anything about it and still have to work. And that is what's going to continue this pandemic, is the fact that people will not be able to stay away from working, and that's carers and people on 0 hours contracts. It's a crime. It is absolutely a crime.
Claudia, could I come back and just make one point?
Well, we haven't got a lot of time. If it's very quick, because I just want to see if Fran wanted to say something, and then we need to just very quick, Bob.
Yeah, the American system is more than twice as expensive and has millions of people without insurance.
Yes.
And with the current pandemic crisis, 43 million people have lost their job, and with it has gone their health insurance.
Exactly.
Yeah. Thank you for that. And just, Fran, did you want to say any final words? In particular, yeah. Did you want to say any final words, Fran?
Please, and thank you, Claudia. I want to echo Kathy's point about mental health care in schools. I think this is really, really important. It would be really easy to embed mental health care teams in schools. We've got in many schools there's a pastoral system anyhow, so it'd be actually quite easy to, make it part of that system and have it available for every child without these huge long waits. It would also mean that they could run a drop-in service for parents who've got difficulties. There's all sorts of really innovative and positive ways that could make a huge difference in people's lives. I just also wanted to talk one more bit about COVID, because it's something nobody's yet spoken about, and that is the people who've had COVID but have recovered, but whose health has not recovered. Who are going to have long-term health conditions for the rest of their lives. I've been following some of the stories that have come out into the medical press and looking at some of the doctors and nurses who've had COVID. And, you know, 4 months on, they are nowhere near recovered and well enough to go back to work. COVID is going to give us a whole new generation of disabled people, and nobody's thought the consequences of that through and how on earth that is going to be managed, because it will need to be. And there's a particular fear with the DWP because there is no research, there's nothing to prove that your symptoms, if you are applying for benefits, are going to be due to COVID. So how on earth do we get believed when we tell our stories for money that we desperately need?
Thank you so much, Fran, for those final words. It's so brilliant to kind of like put the picture very clear for us all, that the importance of why we need to engage and respond to the National Policy Forum. And I just really want to just end by just thanking you, the audience, our participants that have been following this throughout, but also to thank our excellent speakers for their insightful contributions. I would like to quickly finish by saying a few words about the health and equality aspect really of tonight's discussion, as this is something that I have been so deeply moved by this evening. I mean, during the costly neoliberal project of the last half century, we have seen that the Tories have so successfully torn apart our social safety net and transferred the wealth that workers create to the super rich. We've heard from Bob how the government is already introducing disaster capitalism, a privatization agenda, and in response to this coronavirus crisis as well. This will further, of course, devastatingly impact on older people, on people with mental health and people with disabilities. And as I guess, as the representative of Leicester East, one of the most diverse constituencies in the country, it has been extremely concerning to see the disproportionate impact of the coronavirus in terms of African, Asian and minority ethnic communities that we've all heard about. This was proven by the government's own report, as we know, which they shamefully only published after repeated pressure, and which still does not have an outline in terms of any protective measures to deal with the disproportionate impact of COVID-19. So we know that the report underscored what we already know, that existing racial and class inequalities coupled with inadequate government support mean that working class migrants and African, Asian and minority ethnic communities are at greater risk and exposure of COVID-19. And I just want to just say that these severe racial disparities in our economy mean that Black communities really are more likely to fall through the cracks of government financial support and are therefore more likely to be forced to work in unsafe conditions. And, we know that the Prime Minister has a long history of racist and offensive remarks, but he recently said that Black lives matter. But to take this, make this a reality, this government must urgently launch a public inquiry. That is what we're calling for, a public inquiry, and Public Health England must issue practical guidance. I hope that you think about this when we are responding to the National Policy Forum. It is incumbent on the Labour Party to recognise, I believe, that the coronavirus has exposed deep intersectional, racial and gendered and class inequalities that must be reversed. And so I want you to stay with this programme. It's so important. And next week, we are going to be having a further session of one of these, which is going to focus on early years education and skills, plus justice and home affairs. And so I want you to share these sessions with everybody that you know, because if we are to achieve the change that we need to see, we must take the energy and ideas from tonight's meeting, and we must engage wholeheartedly with the National Policy Forum. because we know that the crisis we face require radical solutions, and it is only a bold, member-led Labour Party that will be able to deliver them. So thank you for staying with us tonight. Thank you to our speakers, to Dawn, to Anne, to Kathy, to Fran, and to Bob. And thank you most of all as well to Cosmos. Thank you and good night.